The concept of CAV is that the professionals make policy and then we this for policy, and the lawyers in CAV also draft some public member bills and resolutions which can be presented to members of parliament. We also present it to the standing committees of parliament to bring about change. For example, we have some ideas regarding the mental health care bill. We have organized a webinar which is called the Social, Economic and Political Impact of COVID-19 in India, and we have interviewed a number of prominent celebrities, members of parliament, from Mr. Dinesh Trivedi, Kakuli Ghosh Dassidar, Shatabdi Roy, Tanmay Bhattacharya of CPIM. We have introduced Ms. Moitra, we have introduced prominent actor Bacha Muitro, and we are extremely grateful that today Pinaki Misra, Mr. Pinaki Misra has joined us. Let me give a brief introduction of Mr. Misra. He is a member of parliament from the state of Odisha, and he's also the leader of the BJP parliamentary party, and he's also a very senior advocate in the Supreme Court. He comes from a illustrious family, and there have been members of his family who have held high positions both in public office as well as in the Supreme Court. And there have been people who have been Chief Justices. So we are really graced today by such an eminent personality, and we hope we can express the opinions of the medical community and the psychiatric community to him. And we are also looking forward to his feedback on these issues. So I would request Dr. Gautam Saha, who is the president-elect of the Indian Psychiatric Society, and he's also the president of the SARC Psychiatric Society, to ask a question to Mr. Pinaki Misra regarding mental health in both India and South Asia. So Dr. Shah, if you can please ask the question.
Thank you, Dr. Bodhanath Bhojosida. And I'm really happy today to meet Mr. Misra and be with us today. It's a great privilege for CAV and all of us, definitely. Welcome, Mr. Misra. What I'm telling, Mr. Misra, you know there are lots of mental issues associated with this COVID infection. In fact, if you see, there are lots of studies has been done regarding this, that it shows that it is as important as mental illness is as physical illness, because there are lots of mental issues, not only related to the COVID infection, also related to the lockdown period and the social distancing, though it is a physical distancing, but the people are taking it as some sort of distancing between among the close persons. So there are something from the government level, we should take something extra for the mental health problems. In fact, our budget is very low, you know. So what is your take on it? Sir, please. Hello.
Yeah, thank you. Thank you very much, Dr. Meghna Ghosh Dassidar, who is son of one of my very distinguished colleagues in Parliament, Dr. Kakuli Ghosh Dassidar, a very eminent parliamentarian, very one of the most prominent parliamentarians in this both the 16th and the 17th Lok Sabha, a dear friend, a valued friend. So I'm grateful to Dr. Meghna Ghosh Dassidar, as also to Dr. Siddhartha Chatterjee Sahu from Dr. Siddhartha Sahu from my state, who is again a very eminent doctor. Dr. Gautam Saha, who's just asked me the question. Good afternoon to all of you. Yes, these are obviously very, very trying times. There is no question. We are facing, truly, apart from this awful pandemic, we are also, I think, very close to an epidemic of both mental health issues as well as the unfortunate concomitant of that, which is suicides. Just this morning, I don't know if the Calcutta papers have carried this or not, but an All India Institute of Medical Science young doctor, he's a psychiatrist, he was a psychiatrist, 32-year-old doctor jumped from the 10th floor and committed suicide yesterday, which is a serious situation. that a psychiatrist takes his life, uh, obviously, in the kind of situation that we are in today, and faced with the kind of, he was living within the campus of the AIMS, and he took his life. So, uh, Dr. Saha is absolutely right. The position today with regard to psychiatry in India is abysmal. My numbers show that there are 4,000 registered psychiatrists today, to 1.4 crore, rough estimate, give or take, few lakhs, or even in India, a population like India, which is 130 crores, it could even
Yeah,
be a half a crore or a crore up and down, or certainly not down, most
absolutely.
likely up. So 4,000 registered psychiatrists, and there are only 2,000 clinical psychologists. This is the registered
Yep.
number, which is
Yes,
absolutely abysmal number. The decimals are into point zero zero something. So clearly, not enough emphasis has been given, primarily because I don't think we've had the kind of emphasis we should have given at a cutting edge grassroots level from school, college onwards, to build mental health resilience in our society. It is still stigmatized. I think mental health continues to be a very, very stigmatized area. It's like any other disease. It should be treated like any other disease. Instead, it is virtually treated as a disease of ostracism, where you have to be ostracized
absolutely,
and
absolutely.
not to be assimilated in society and looked after. I think because of this, again, there is no emphasis in either support group for counseling as well as for caregivers. So families are also therefore not roped in, and that's a very dangerous situation, I believe, because for every one mental health patient who suffers, there are at least two who are affected by that person's suffering. Those are the numbers. So yes, we are in dire straits in India as far as mental health care is concerned. I'm personally aware of this in my state, for instance, because a close family member is now running what is called the Manam Wellness Foundation in Bhubaneswar. And I know that
Great.
over the last, my own sister runs it, which is a doctor, and she's started this purely, by way of, social work. And the numbers that come in are frightening. Yeah, they are doing virtually, because at the moment they can only do telecounseling, almost 60 distress calls a day.
Certainly,
There are
charger.
4 counselors who are round the clock on distress counseling, and one third out of these, or about 33% of these are suicide
Yeah,
cases, which are potential suicides. So there is a pandemic, and there is now an epidemic which could well assume very alarming proportions. Dr. Saha is absolutely right about the fact that given the abysmal kind of budgets that we give to our health sector, in any case, as you know, it's still absolutely pitiable. It has never gone beyond 1.4% of our GDP, which is shocking. I mean, a country of India's size and diversity, and the kind of population demographics that we have, we should be not less than 8 to 10%. That is the bare minimum of our GDP should be given towards health. Uh, we hope that the government of India will now relook this, revisit this, and from this pitiable 1.2%, 1.3%, 1.4% that we've oscillated over the last 25, 30 years, we go up significantly higher. A large portion of that, according to me, should be towards psychiatry, because we need more qualified psychiatrists, we need more qualified clinical counselors. There is no doubt about it. And I'm certainly hopeful that people like Dr. Kakuli Ghosh Dasdar, who's such an active member of parliament, and who has spoken on medical issues in the House repeatedly, and has very vigorously canvassed medical issues in the House, that she will take it up. I personally also intend to take it up, because in the past 4 months, having seen what is happening with this Manam Wellness Center Foundation work in Bhubaneswar, I'm absolutely appalled and alarmed at the scale of this epidemic. which needs to be arrested at the earliest. That's about all I can say at the moment. It's a dismal situation. We have to work towards vast improvement and at a very, very rapid pace.
Thank you, sir. It's a really great input. And one thing just I shall added the actual picture, the treatment gap. Because in India, right now we have one psychiatrist per 2 lakh population. It is the information from the Ministry of Health and Family Welfare. But we need it 1 in 10,000, 8,000 to 10,000. So it is a huge treatment gap. We have to look up to this. Thank you, sir. Thank you.
So my next question is to Dr. Boytanath. That is, we started this thing, this pandemic situation with poetry and all these things. But the thing is this, Corona still is there. So how we will cope up? Again, the second session of lockdown happening in Kolkata and maybe some other places also. So what do you think that is how we will cope up with this particular situation? So could you please let us know this thing?
At the outset of the program, I would request noted actress Srilekha Mitra and human rights activist to ask 3 questions to Honorable Member of Parliament Mr. Pinaki Misra ji. As I have already stated, Pinaki Misra ji is a member of the Lok Sabha. He is also the parliamentary party leader of the BJD, and he's also senior counsel in the Supreme Court.
A very good afternoon to you all, and especially to Mr. Pinaki Misra. Well, I do have 3 questions for you. I have jotted it down, so I'm going to just tell them random, ask them random. My first question is, how long will it take for a developing country like ours to recover from the scars of the pandemic? How long will it take for a developing country like ours to recover from the scars of the pandemic? Question number 2, do we expect a more selfish society in post-pandemic India, or we can expect a more compassionate bonding between humans? 3, which I'm forming it, haven't noted it down. The area which I live in, this apartment, is a very hostile environment for pets. I have 3 pets at home, and plus I feed few strays on the streets and have been feeding them since I came into this society. So the people who lives in this society are very anti me about feeding them. They littering in the premises, not my pets who are with me. And there have been numerous instances where we see that even children, they are kind of very hostile towards animals. The past cases, the murder of the elephant, pregnant elephant, the slaughtering of the different animals, not for food purpose, the torture part I'm talking about. What is the reason behind so, and can at a very crucial stage, at a very initial stage, say during the school days, early school days, can this be a part of our education system as to be compassionate towards animals, and not to treat them as somebody who is very, who's very ferocious or who can harm you, because animals, my experience says that they are far better than humans, and I have been personally facing this. So I would request you, sir, it's more of a request than a question, that can we have more rigid laws against animal cruelty, and can we as humans be more sympathetic towards animals, and can the parents as well as the teachers be help the students to develop bonding between animals and humans, because we are displacing animals, we are torturing animals, and in consequence, what is happening is humans are becoming more hostile towards the environment, towards the animals and everything concerned. So these are my 3 questions to you, sir.
Well, I think Srilekhadi has asked 3 questions. Now, 2 of them are directly related to COVID-19, and I think both Dr. Sahu, myself, have questions on similar lines, because today's panel discussion is about COVID-19, its medical, economic impact. Now, Srilekhadi has asked a question upon the cruelty towards animals, and she's also raised the issue of the death of the elephant in Kerala. Now, I think we can have a separate webinar on the issue of animal cruelty, and see if we can also form a bill or formulate a bill, a private member's bill, um, in regards to the protection of animals and rights of animals in India. And I think we can again invite a prominent MP, and perhaps we can again invite uh, Member of Parliament Pinaki Misra ji to our program. But I think whatever Srilekhadi has said, the 3 issues she's raised is very pertinent.
I do have a question to Mr. Pinaki Mishra
Yes.
in continuation of the first question, because I think Mr. Pinaki Mishra raised a very valid question of medical professional suffering from depression and incidents of suicide amongst doctors. Now, sir, there is a very pertinent question that there is a very big gap between MBBS and MD seats in India. Like when Dr. Sahu and myself appeared for the MD entrance exams back in 12. At that time, there was something like 3,000 clinical seats in India for MD, and there were 100,000 MBBS who appeared for the MD entrance exams, and there were 5,000 seats which were both clinical and non-clinical. Now, although the MD seats have grown up, but India is the only country. India is the only country in the world where the number of MBBS is far more than the number of MDs. I believe that the MD seats is not even 10% of the total number of doctors who are there. Now, the issue at hand is that when a doctor completes MBBS and he doesn't have MD, he has no medical training. So most doctors in India are literally unemployed. Unemployed in the sense they can't make money and they can't even treat patients. Now, I'm sure that Parliament could pass a law and increase MD seats. And increasing MD seats is not a very big issue because it takes one faculty to teach 3 MDs. And even if they don't increase MD seats, I'm sure they can get training and do their MRC exams. So why do you think Parliament is so ignorant towards the needs of doctors on such critical issues?
Let me, Dr. Dasda, let me honestly tell you, this is not so much an issue of relating to Parliament as it is an issue relating to, I think, to the Medical Council of India, because all this is, as you know, regulated now by the Medical Council of India, which is supposed to be an autonomous body. Unfortunately, the working of the Medical Council of India over the past 2 decades or so has left so much to be desired that the less said about it, the better. There is no doubt about that. It is an institution which, unfortunately, has not risen to the occasion that the demands of the time have placed upon it. So, in terms of legislation in Parliament, I think Parliament has put in place a fairly effective mechanism which ought to work. That mechanism is not working. Therefore, more than Parliament, I think it is a ministry problem. This is more an executive problem. It's not a legislative problem. We don't need more laws. I think we are already over-regulated. So therefore, according to me, this country, what it needs is less laws rather than more laws. We have enough laws. We have enough regulations. They need to be regulated effectively. So you are right that this is something that should be agitated with the Ministry of Health and Family Welfare. The good part is, and I say this advisedly, even though we are not part of the government, that we have today in Dr. Harshvardhan, for instance, in Delhi, in the central government, a man who's a doctor himself, a very eminent doctor. He's well-meaning. open to ideas and suggestions, very importantly. So therefore, I think if you make a good, well-founded representation to him in this regard, I think we can carry it to him. It's a matter which the ministry needs to look into with the aid and advice of the Medical Council of India as to how to raise MD seats. But this, as you know, is again a pandemic in India. The problem of too few seats, both in schools, in colleges, in universities, everywhere. There is this huge problem in India of demand not being able to meet the massive supply that is required for a population the size of India. But be that as it may, this is a niche field, it's a much narrower field. Therefore, according to me, it should not be that difficult to expand this to at least manageable size, where MBBS graduates don't suffer simply because they haven't had the opportunity to go ahead and get an MD degree, which is an absolute bare prerequisite. I completely value your point, and we should take this up with the ministry itself. I think Dr. Dastidar and me can both work towards it.
So there's a supplementary question regarding the medical infrastructure which exists in India and MBBS colleges, especially government medical colleges. Now, sir, I would like to draw your attention to the fact that the MBBS entrance exam, like whether it is the joint entrance which is conducted by the Orissa or the Bengal government, or the TMT exam or the NEET exam, these exams are the toughest exams in the world. In fact, sir, NEET is one of the toughest exams, and it is comparable to IIT. So we can say the people who are going to government medical colleges, they are the best students in the world. And I'll give you just one example. Sir, Yale University has a acceptance rate of 12%. Harvard University has an acceptance rate of 5.6%. Whereas medical colleges in government medical colleges in open seats, the acceptance rate is 0.1 to 0.5%. So these are the best students. But sir, I wish to tell you reality, medical colleges in India are in very bad condition. If you leave apart AIIMS and PGI, most medical colleges don't have hostels for students. It's a fact. The food which is given in medical colleges is unfit for human consumption. There are no standardized classes. The curriculum in MBBS is way behind international standards, to such an extent that when MBBS students have to prepare for NEET, or they have to prepare for USMLE, they have to take extra classes and coaching. And even compared to, say, a college like, for example, even private colleges of St. Stephen's, MBBS colleges are thoroughly neglected. And again, this is an area where there is no budgetary allocation, and personally I feel people in Delhi don't care. Like, there is no comparison between the campus of St. Stephen's and any reputed government college in India. And I have friends who have done MBBS from Pakistan. I'll give you the example of Aga Khan University. It is world class. Whereas other than IIT, every medical college doesn't have basic infrastructure. So I understand Parliament has limitations, but what do you think government can do, or the executive branches can do? Because this is very pertinent. Because if you don't train doctors properly, then your healthcare will collapse.
This again, Dr. Meghna Nandi, this again is epitomizes the problem we've had, which I highlighted in my preface about budgetary allocation. You cannot, in a country of this size, have a budgetary allocation given to health which is 1.2, 1.3% of your GDP. All this is because of lack of resources. Let's face it. The fact of the matter is there's a fund crunch. What you're asking for basically is better infrastructure. You're asking for better provisioning. You're asking for just basic amenities, which really are an absolute prerequisite for creating world-class doctors in this country. Because all over the world, I mean, I've been to New York, the best hospitals in New York. There are Indian doctors everywhere. Entire floors are manned by, my wife had a very major spinal surgery in New York, in the Hospital for Special Surgeries, which is, the number one hospital in the world. It's like the Wimbledon of of hospitals, and I think 20% or 25% or 30% more are Indian doctors. So we have the capacity to create world-class doctors. We need to, you're right, give them basic infrastructure to do it. For that, you need to give more budgetary allocation. I sincerely hope that this has taught us a lesson cutting across party lines on a bipartisan basis in Parliament, for everyone to ask government to give us a little more in terms of budgetary allocations. As I said earlier,
Absolutely, sir.
8 to 10% is a bare minimum, but let us start at least with 4 to 5%. It will make a
At least.
huge difference in providing infrastructure in these medical colleges, which is sorely lacking, as you rightly said.
You are right, sir. And in this context, I want to mention that the total health budget and especially the mental health budget. What I want to inform you, sir, we have done a study in this COVID area, in this COVID period, that the almost 34% patient have a severe anxiety disorder and 9.5% have depressive disorder, and two-thirds of the people, general population, like 74.1% have moderate stress disorder. So much of mental health problem is common in this COVID period. So we need much more mental health professionals during this period, and also in general also we need much mental health professionals. You have also mentioned that the solution is increasing MDC, and also what I think, there should be a awareness program as well, that people can come to the mental health professional, which
Yes,
can
Dr.
reduce
Saha,
this.
on this point again, and let me ask Dr. Sahu what his review regarding this, and please ask your question to Mr. Pinaki Misra.
Okay.
Okay. Very good afternoon to you, sir. So everyone, I think outside Odisha is very curious to know, what were the challenges Odisha faced, and how they've been managing so far the COVID crisis. Because people have appreciated the way with which rapidly new COVID hospitals were built up. The excellent protocols that are being talked of as the Odisha model of COVID. So, sir, could you tell us a bit about that, sir?
This morning's figures at 11 o'clock, I was checking. We have roughly 12,000 identified patients in Orissa in a population of 4.5 crores. So 12,000 in a population of 4.5 crores, out of which 8,000 have already recovered. So that's the recovery rate, and 56 deaths in a population of 4.5 crores. Compared to forget the international figures, but even the national figures, obviously we are way better than any other state, barring perhaps Kerala. What did we do right? I think, as usual, Mr. Naveen Patnaik, who has been hailed and lauded by all international agencies for his very quick response to natural calamities. And we've been buffeted by 6 super cyclones, extremely severe cyclones, between 2012 and 2019. It's in fact 20. Amphan also partially hit us, but last year Phony, Bulbul, Titli, all these cyclones have been a massive learning curve for the state. Compared to the 1999 super cyclone, where 20,000, 25,000, we don't even know the number yet. Between 20 and 25,000 people are supposed to have died. In all these cyclones, by the cyclone-related deaths have not been together in 6 cyclones have not been more than 100. Somebody may have died of other related comorbidities during that period, but cyclone-related deaths have not gone beyond 100 in 6 super cyclones, extremely severe cyclones. So he has put in place, Mr. Patnaik has put in place an extremely efficient, very quick response system. And that is what kicked in the COVID scenario as well. We realized the problem about COVID very early on. As soon as the alarm bells came in from China, immediately Orissa began to prepare itself. We began by first ensuring that there's a COVID hospital in every district in the state. We have 30 districts, so COVID hospital in every district. In fact, in some big districts like Cuttack, etc., we had 2 or 3 COVID hospitals. Cuttack, Khorda, Ganjam. We've also then began the problem, for a very long time, actually for almost about 4 weeks, our COVID numbers were in the range of 50, 60, 80, 100, 150. That's it. It is when the unfortunate scenario of the migrant labor coming back began that the numbers started to swell a bit, because most of our migrant labor works out of Gujarat, works out of Maharashtra, which had seen very heavy COVID numbers. So this number now of about 12,000 is basically the migrant returnees who have come back with the infection. For them, in any case, the government immediately had quarantine centers set up in every panchayat. So there has been a very effective system put in place. There's been a very effective lockdown system put in place. Mr. Patnaik is on television virtually twice a week, telling the people, what the latest position is, giving them advice. There is a full-fledged COVID task force in the state, which is headed by a very, very very efficient and how shall I put it, a very significantly proficient professional, Dr. Subrat Bagchi. If you people remember, there was a company in Karnataka called Mindtree, which is one of the best startups for information technology. Dr. Bagchi was actually a co-founder of Mindtree. Gave up. Mindtree is taken over by L&T now, so these people came back with a very large amount of money only to do public service. So he's in public service in Orissa. He was made the head of the task force. We have a 5T secretary, which is called transparency, etc., etc. Mr. Pandian, who again is looking after the efficiency of these hospitals, etc., on a cutting edge level. The chief secretary, all these people liaise together on a daily basis, and therefore it's really been this overarching presence of Mr. Patnaik, who's looking after everything with an eagle eye. Bureaucrats who have been given specific districts in charge, senior secretaries have been given charge of various districts, and the political class is then asked to, the MLAs and MPs are asked to interface with the panchayats to ensure that the sarpanches and these elected officials sensitize the people coming back from the migrant labor which comes back, to persuade them to use these quarantine centers to ensure that they don't spread this disease further. And very interestingly, we've put in a little system of incentivizing. So if you go to a quarantine center at the end of your 2-week quarantine, you get 2,000 rupees. You are also given the option of working on a daily basis if you are well enough in the quarantine centers, and you get your per diem. So everybody walks out there ultimately with some amount of 4,000 or 5,000 rupees, which they've made over the last 14-15 days. So that's again an incentivization for people to go into quarantine, apart from the fact that 3 times a day full cooked food is given, all their basic sanitation necessities, everything is taken care of. So government has taken care of virtually everything. They've really nursed them back into society, as it were. It's a very, very a system which has been set up with deep empathy, which is not adversarial at all, and therefore the synergy between the people and the government beautifully, and that's about all I can say. It's a good model to follow. I wish other states follow the same model.
Okay, thank you so very much, Mr. Pinaki Misra. Now, my question is to Dr. Boidunath Ghosasadar. If you have any questions to Pinaki Misra ji, please ask, sir.
Well, there are 2 questions, but very similar. One is, there was a standing committee of parliament which got recommendations from, I think, economist Mr. Panagaria and also Narayan Mukti, which had suggested that salaries of post-MD doctors should be in line with that of IIM graduates and IIT graduates, considering the level of expertise. And the report is still pending with Parliament, and no action has been taken on that. And in addition to that, most colleges, medical colleges, don't have research programs or research exchange programs with foreign universities. So, sir, how do you think an organization like CAV, which works in healthcare and medical education, can collaborate with members of parliament like you or other MPs to raise these issues in the public narrative?
Well, aid and advice is always going to be welcome. The best thing is to send in written representations, which we then forward, which sometimes are taken fairly seriously. The problem of, again, under paying doctors, I agree, is one of the great problems, and which is why you find that doctors are unwilling to really give full-time service when they are government doctors, for instance, and they're always shirking a full-time government job. They take up government jobs and are very often seen doing private practice. And that unfortunately, that's a harsh truth. If you don't pay them enough, this is what is going to happen. So therefore, I completely empathize with you. I agree with you. It's a very serious problem. Government should completely reorient itself to paying professionals what is their due, because at the end of the day, they've studied very hard, they've worked very hard to reach where they have, and therefore if you underpay them, and particularly when they see their peers who are, as you said, in products of IIM, etc., when they see their peers are getting salaries running into crores, and when they see private doctors again making a very large amount of money in private hospitals as well as private nursing homes, then the incentive for them to be in a government service which pays them a pittance is unfortunately cannot be there. They are then bound to gravitate towards either go abroad or towards private practice in India, which is why the brain drain is so significant. The best of our doctors therefore tend to not be there in areas of public service, rather they choose private practice. And you're absolutely right. It's again something which I don't know how far we can legislate on this, because you can never legislate salaries. The parliament can't legislate salaries. Again, this is something, the mindset has to change. The Medical Council of India must pay attention to this. It's a question of, again, budgetary proposals as well. Because if the government has more money, if the health ministry has more money, government hospitals will pay more. It's a fact of life. Because I don't think private doctors who are in private hospitals or private nursing homes, I don't think they have any complaints at all. They're doing reasonably well. In fact, very well. Some of them are friends of mine who are doing very, very well. At par with professionals like lawyers and IIM graduates, etc. But it's the government doctors who are not paid sufficiently, I believe, as a result of which our public health system is in such disrepair.
Now, sir, I would add another question. A request has come from an American doctor of Indian origin, Formulika Roy. She heads the ING chapter of the American Medical Association. Now, a very important development has taken place, whereby the FMG, that is the American Council which recognizes foreign qualifications, they are going to de-recognize the Indian medical degrees of several colleges from 2022. And the Pakistan Medical Association has taken it up and they have resolved it. But there are reports that Indian medical degrees from several colleges will be de-recognized. And this request has officially come to us from various American doctors of Indian origin who have gone through the process of USMLE. Now, many doctors after doing the residency, they go to America to do their fellowships. Like, I'm myself going to UK to do my fellowship. So, again, this is a very critical area where I think the IMA or the health ministry could, take it up. So, hopefully, we can have a conversation with your office on this matter, because again this matter is technical. And
please take it up with the honourable member, with the honourable MP, your mother, Dr. Dasadar. I think she and I will be very happy to jointly espouse this in Parliament as and when Parliament reopens. We'll be very happy to take it up. No difficulty at all. I can discuss this with her because she's a very active, very active parliamentarian. Yeah. And I have no doubt that we can both vigorously take this up in Parliament.
Yeah. Thank you so much, Pinaki Misra ji. And now I would like to ask Dr. Gautam Saha. Sir, would you like to ask any question to Pinaki Misra ji?
Yes, Mr. Misra. Thank you for to be here with us today. You have already mentioned the importance of suicide, especially you know that the most of the suicide occurred in the two countries, India and China, more than half in the world. And if you see in India, every 40 seconds, one man committed suicide and 20 people attempted suicide. So it is a really very important area of mental health. We have to take care. My question is, sir, from Indian Psychiatric Society, we are thinking of opening up suicide helpline. There are lots of suicide helpline over there. Though few of them might be, two of them are 24/7. But my request is anything can do from the government level for this purpose. Can take any helpline, organize like helpline, or if we organize helpline, government can help us a lot.
Again, this is something where we need to discuss this with the health ministry, because this is a Ministry of Health issue. So mental health, I believe, ought to form a very important part of the Ministry of Health. I don't believe at the moment mental health is at all considered a health problem. I think mental health is
almost like that.
Is virtually out of the pale of the entire medical science, and it's very unfortunate. So therefore, you are right. I think if you make a representation from the Indian Psychiatry Association, of which you are a very distinguished president, I think if you make a representation, we will all add our weight to it. And I'm sure Dr. Harshvardhan is very enlightened, and I'm sure he will. He's in fact, there's another article today. He has just transferred a very important functionary, not the director, below him in the All India Institute of Medical Science, because a Dainik Jagran reporter also committed suicide 2 days back. Yeah. So Dr. Harshvardhan took immediate steps to transfer out the key person who was in charge of looking after it, because he was not given enough mental health counseling. So Dr. Harshvardhan is, I think, fully mindful of it, and now with this latest suicide yesterday, which has hit the front pages today in Delhi papers, I'm sure he will be very mindful of the extreme problems being faced. So we should have this helpline up and going in no time at all.
Okay, thank you, sir.
All right.
Thank you, our panelist, Dr. Gautam Saha, and thank you, Pinaki Misra ji. Dr. Siddhartha Sahu, do you have any questions to Pinaki Misra ji?
Okay, sir, I have a few questions. Now, the first thing is, in a state like Odisha, which is dependent on remittances from from our expatriates working outside, and seeing that all economic activity has essentially come to a standstill. So how do you feel, sir, that coming forward that Odisha will overcome these financial challenges that all the people of Odisha are likely to face?
Look, the unlockdown is almost fully happened now. So there is already a reverse migration which has begun. It's actually to say that only Orissa suffers from this migration problem is not correct. The migration is something which is in India, which is an aspirational thing. People go from Bihar, people go from UP, people go from Orissa, in Orissa there are a number of people who come from Telangana, from Andhra Pradesh. They are working there. So therefore, this is a matter of aspiration, where each according to his ability, from each according to each according to his need, they like to travel. So a lot of people try to say that, people leave Orissa and go and work outside because there are no jobs in Orissa. That's not quite correct. There are jobs in Orissa, but we don't, for instance, have a diamond polishing industry in Orissa. Now there are people who are qualified to work as diamond polishers, so they will have to go to Surat where that happens. But people who work in the steel industry, who work in the aluminum industry, who work in the mining industry, they come to Orissa, and they come from other states. So unlockdown has happened now. The position will really be restored back to, I think, a status quo ante. Life will go back to normal gradually. A lot of people are now wanting to go back. You must have seen in the papers, companies like Infosys and all are now in fact running chartered flights from Bhubaneswar to Bangalore, from Bhubaneswar to Hyderabad, from Bhubaneswar to Bombay, because they're taking professionals back. Similarly, special trains are now carting back people who are willing to go back to Gujarat, willing to go back to Maharashtra, to go back in the construction industry, etc. So that water will find its own level. I don't seriously see a very large mismatch between the available talent pool and the available jobs. That was not there before. That's not going to be there in future, Dr. Sahu. I think there is an interregnum. There is a time lag during which period we all have to look after each other in terms of societal needs, in terms of family needs, because there will be that time lag before things come back to complete normalcy. That nobody can deny. But I don't believe that it's insurmountable or that there's going to be a long-term problem, because I believe we're coming back to fair degree of normalcy very, very quickly. And that's a good, happy sign. So can we...
Yes.
So basically, I would thank all our panelists. I think we end our program here and we wrap up. CAV Foundation, sir, you would be happy to know we've been running helplines during COVID-19 to tackle stress, and the number is 98301 which operates 24/7 to help people with stress, anxiety related to COVID. And as part of our foundation, we would of course want to work with your office, and we do online counseling for school children and underprivileged children, by which we provide counseling by Zoom, and we also give forms and we assess mental illness, SLDs, and then we give feedback to schools. So if you would be interested of some program in your constituency in poor areas, we would do that free of cost. And Sahu will organize.
Dr. Sahu, and Dr. Sahu and I can then coordinate with your office.
It will be my pleasure, sir.
Thank you.
Thank you, Dr. Misra.
Thank you so much.
Thank you.
Thanks to all of you.
Thank you, both Jonathan and Mrs. Meghna.
Thank you again.
Thank you.
Thank you so very much. ভালো থাকবেন.
All the
Thank
best.
you.
Stay safe.
Okay, thank you so much, sir.
Same.